Hi, my name is Jack LaRiviere. I'm an AGA CMP student at the University of Northern Colorado. Today I'm going to be performing an integrated musculoskeletal and neurological exam. The first thing that I'll be doing is, basically the way that this exam is going to go is I'm going to start at the head and work my way down towards the feet. Some of the things are going to be a little out of sequence, but that's to prevent the patient, Kristen, from having to get up, sit down, turn over, etc. So we'll try to follow things as best we can. So the first thing I'm going to do is visualize the upper extremities, the head, the neck, make sure that everything is symmetrical. Kristen had her wisdom teeth out the other day, so her face is a little asymmetrical with swelling, but as far as the shoulders, the neck go, the scapula, everything looks to be of normal size, color, symmetry. There are no bony malformations, no heat coming from her shoulders, her excessive heat is what I mean to say. Her neck area, the vertebrae there. So we'll move along here. The next thing that I'm going to do is assess for a range of motion of Kristen's neck. So the first thing that we'll have, we're going to be assessing flexion, extension, lateral flexion, and rotation. So the first thing we'll have Kristen do is bring her chin towards her chest, assessing flexion, now backwards and looking up at the ceiling for extension. The next thing I'll have you do is bring your left cheek to your left shoulder, checking for lateral flexion, and the same thing on the other side. And I want you to tell me if you're experiencing any discomfort when you do this. And so everything looks to be symmetrical in her movements. She's not experiencing any discomfort, so we can move along. Next thing I'll have you do is look all the way to your left and all the way to your right. Everything seems normal there. So we can move on. The next thing that we're going to do is I've already looked at Kristen's upper extremities, palpated her clavicles, her AC joint. I don't feel any rising in that, indicating that there's a separation in the joint. There's no pain, swelling, discoloration, etc. And so we can kind of move on. The next thing I'm going to do is test the deep tendon reflexes of Kristen's biceps, triceps, and brachioradialis. The biceps will be testing the C6 nerve root. So what I'll have Kristen do is bring her arms forward like this. And I might need to move Kristen's arms a little bit just to loosen them up and ask her to relax. Then I'll put my finger on her biceps tendon and I'll tap, looking for flexion. You might not see the flexion as much, but you'll feel it in the biceps muscle. And that's a 2 of 2 tendon, or a 2 of 4 tendon reflex, which is normal. And we'll do the same thing on the other side here. Perfect. And I can feel her bicep flexing, and so we will consider that a normal 2 of 2. So we'll move on to the brachioradialis here. We'll have you just relax. And the brachioradialis is assessing the C6, C7 nerve root. So we'll tap here again. And I'm looking for wrist flexion. Perfect. And I'm seeing a 2 of 2 reflex bilaterally. So we can move on to the triceps, which is, the triceps is a C6, C7 nerve root. So I'm going to support the patient's arm, and I'm going to be tapping on that triceps tendon here, looking for arm extension. I'm seeing a 2 out of 4 reflex there. And the same on that side too, which is normal. So we can move on. The next thing I'm going to do is assess Kristen's shoulders for her range of motion, strength, and then I'm going to be performing a couple tests to assess for rotator cuff injury. So the first thing that I'll have Kristen do is bring her arms up above her head and cross, indicating that her shoulder abduction is intact, normal range of motion, and I should be feeling, would you put your arms down again and then repeat that upwards? And normal strength there. Now bring your arms down and I'll feel your strength there. both 5 out of 5 on the abduction and adduction, and then I'll actually have you bring your arms down and cross in total adduction, and that is normal. So the next thing we'll do is assess for internal rotation. So I'll have you bring your arms out like this, and then I'll have you point your hands down and then point your hands up. So that was internal first and external rotation second. Seems to be intact. Would you bring your hands down, and back? 5 out of 5 there, and same on this side. 5 out of 5 there. Perfect. You can put your arms down. So the next thing I'm going to do is perform a Hawkins test to assess for a rotator cuff, specifically a supraspinatus tendon injury. So what I'll be doing is I'll have the patient put her arm out forward and bend her elbow at a 90-degree angle, and then I'm going to passively internally rotate her shoulder. Are you feeling any pain there when I do that? If she was feeling pain, that would be a positive for this test, indicating that there may be a rotator cuff injury. And we'll do the same on the other side. Are you feeling any pain?
No.
Perfect. So we'll move on to the drop arm test. So what we'll have Kristen do is bring her arms up right above her head and then drop her arms to her sides very slowly. If one of her arms were to give out suddenly and fall to the side, that would be indicative of a rotator cuff injury. You can put your arms down, and further investigation would be needed. The next thing I'm going to do is inspect Kristen's elbows, working our way down here. So I'll have you bring your elbows out like this. The first thing I'm going to do is inspect. If she had psoriasis or eczema, I might see some lesions on her elbows, but they look normal. The next thing I'm going to do is palpate the medial and lateral epicondyles of the elbows, the olecranon process, and then palpate around, apply pressure for any ulnar nerve dysfunction or hyperexcitability here. Are you feeling any discomfort there? Okay, so we can move on. Everything seems to be normal there. The next thing we'll do is test for elbow flexion and extension, and we'll also be testing for hand strength and wrist strength here as well. So what I'm going to do is have Kristen grab my hands, squeeze them as hard as you can. I would say that's 5 out of 5 for hand strength. Now pull towards you and push towards me. And for elbow strength, 5 out of 5 on flexion and extension. So we can move on here. The next thing that we're going to do is, and I forgot to say that if I found any swelling or heat around her elbows, that might be indicative of bursitis or epicondylitis. But we'll move on to the wrists and hands now. So the first thing we'll do is inspect and palpate. I'm going to be inspecting the carpals, the metacarpals, the interphalangeal joints, looking for any swelling, nodules, etc., which may be indicative of injury, rheumatoid arthritis, osteoarthritis, etc. Everything looks normal, normal size, color, and it's a normal temperature as well. So the next thing we'll do is assess for wrist and hand motion, range of motion and strength. So we already assessed strength, which was normal, 5 out of 5. Next, we'll assess for range of motion in the wrist. So, Kristen, would you put your hands out like this and flex your wrist downward? Now extend your wrist upward. Next, we're going to test for radial flexion. So bring your thumbs inward and then bring them outward, and ulnar flexion. Everything seems to be normal there. And next, we're going to test the fingers. So would you ball your hands up in a fist? So normal flexion there, and then hyperextend your fingers outward. Perfect. So metacarpal hyperextension is normal there. The next thing that we will do is move on to assess for any carpal tunnel syndrome that may be present. So the first, we're going to be doing 2 tests. The first one is Phelan's test, which should normally be a 90-second test, but for the purposes of this video, we're going to shorten it. So what the patient would do would be to put the dorsal aspects of each hand together and then apply pressure to the wrists here for 90 seconds. Now, if the patient's 3rd, 4th, and 5th digits were to become numb or tingly, that would be a positive Phelan's test, indicating that there could be some carpal tunnel syndrome occurring. The next test that we'll do is called Tinel's test. I'll move Kristen's wrist around a little bit to relax it, and then what I'll do is support her wrist. I'm going to be tapping on the carpal tunnel on the median nerve, and if she's experiences any of the same symptoms, the tingling or numb third, fourth, and fifth digits, that would be a positive Tyndall's test. So I will tap on the median nerve. Are you feeling anything abnormal? So, and I would do the same thing on the other side, and everything seems to be normal there. Pardon my adjusting this camera angle here. Okay. The next thing we're going to do is rapid alternating movements. So I'm going to have Kristen do a series of repetitive movements to assess for cerebellar dysfunction. So the first thing I'll do is have her put her thumb and index finger together and tap them very quickly. And then I'll have you alternate through your fingers here. And she seems to be doing that fairly well with no trouble at all. So we would call that a normal finding. The next thing I'll have you do is tap the dorsal aspects of your hand and then rotate with the palmar on your thighs. And she's not having any trouble with that, which would indicate the cerebellar function is normal. The next thing we'll do is point-to-point localization with eyes open and closed. So what I'll have Kristen do is reach out and touch my finger. Same on the other side. Then I'll have her close her eyes and do the same thing. Nailed it, Kristen. Everything seems to be intact there. So the next thing that we'll do is the finger to nose test. So what I'll do is have Kristen follow my movement. Perfect. Now I want you to close your eyes and do the same thing. Touch your nose. Perfect. Everything seems to be intact there. We'll next move on to proprioception. So what I'll do is I'll have Kristen close her eyes, and I'm going to be moving her index finger in different directions, and I want her to tell me which direction her finger is moving in. So
down, up, right, left.
Perfect. So proprioception is intact in the more proximal extremities here. The next thing that we'll do is check out stereognosis, which is the recognizing of an object. So I'm going to have Kristen close her eyes. I'm going to show the camera what I'm going to place in Kristen's hand for her to tell me what it is. Okay, so I'm going to put this in your hand. Can you feel it and tell me what it is?
It's a safety pin.
Perfect. So she has normal findings for stereognosis. The next thing I'll do is a graphesthesia test. So I'm going to be drawing a number in the palm of Kristen's hand, and I want her to tell me what that number is.
8.
That is correct. The next thing that we're going to do is a 2-point discrimination. So I'm going to be doing this on Kristen's hands. As you move towards upwards on the extremities, the hands are very highly innervated and they're able to discern multiple points touching. But as you move more proximal to the body, the body will not be able to discern that. So we'll test on the hands. I want you to tell me how many points are touching your finger right now.
2.
Okay. How about now?
1.
Okay. And then I'm going to test on a different spot on her body if Kristen can feel the difference between a soft or a blunt sensation and a sharp sensation. So would you tell me if this is blunt or sharp?
Blunt.
Okay. And then I'm using the safety pin. Obviously, I wouldn't say that to Kristen next time because she would know that it would be sharp. But we'll continue on. So those are normal findings. She knows, or she was able to discern. The next thing that we're going to do. Oh, and I should say that if she was having trouble discerning, that would we would maybe assume that she has some neuropathy, which might indicate that some disease process like diabetes or some sclerotic nervous disease was occurring. So we can now move on to a vibration test. Again, testing for neuropathy. I'm going to use this tuning fork. I'm going to strike it, and then I am going to stop the tuning fork at a certain point. I'm going to apply it to one of Kristen's interphalangeal joints and ask her to tell me when it stops. If she was unable to tell me when the sensation stopped, I would keep moving more proximal in her body to find out at which point she was able to recognize where that sensation was occurring, and we could kind of assess where the neuropathy extended to. So here we go. Tell me when this tuning fork stops, Kristen.
Stop.
Okay, so she has normal findings there. The next thing that we'll do is we'll move on to, I'm going to ask Kristen to stand up, and we're going to assess her back. And so the first thing that we're going to do is, could you turn towards the camera a little bit? We're just assessing for symmetry, that the scapula are at the same level, they're symmetrical in appearance, there's no scoliosis or deviation of the vertebra anywhere. I'm not feeling any bony abnormalities or temperature differences. The color is normal. And then the next thing that we will do is actually we'll test Kristen's gait first. So what we'll do here is have Kristen, we're just going to ask Kristen, let me direct the camera at the floor so we can see what we're doing here. We're going to ask Kristen to just walk normally forward and back to assess her gait and her cerebellar functioning. And that seems to be normal. The next thing that we're going to do is assess Kristen's ability to do toe walking and heel walking, another cerebellar test. So I'm going to ask Kristen to walk forward on her toes and then walk back on her heels. Perfect. No problems there. Okay, the next thing that we're going to do, pardon my camera angle adjustment, is we're going to do a Romberg test. So come forward a little bit, Kristen, would you? Thanks. So what we'll first do is ask Kristen to look straight ahead, and I'm going to be looking for any abnormal movements. Just stand straight up, please. And I'm going to be assessing for any abnormal movements. Perfect. And now close your eyes, and I'm going to be doing the same thing. And everything seems to be normal there. The next thing I'm going to have Kristen do is stick her arms straight out with her palms supinated, and then close her eyes. And then I am assessing pronator drift right now. And neither arm is falling, so you can put your arms down, which indicates that her cerebellar functioning is intact. Next we'll move on and have, we're going to assess Kristen's back and her range of motion. So the first thing that we'll do is have Kristen flex forward, bend forward. And then we'll have Kristen bend backwards and assess back extension. And then also we'll have Kristen act like she's going to touch her ankle on this side for lateral flexion. Same on the other side. Perfect. And then I'm going to have Kristen look back at me to the left without using her neck. Would you try that again without using your neck? Perfect. Rotation of the back is normal there. And normal on the right as well. I also forgot that we should ask Kristen to do some heel-to-toe walking. So I'm going to adjust the camera angle again. So I'm sure everybody's seen this on COPS, but we're going to ask Kristen to walk heel-to-toe, and this is again a cerebellar functioning test. Perfect. Looks good. We'll adjust again. So going back to the back, everything looks normal. The next thing that we're going to do is assess some hips. So first I'm going to be palpating the posterior superior iliac spine, the anterior superior iliac spine, the trochanters of the hips. They're all symmetrical, normal height, and so we can move on with this examination. Next, I'm going to be assessing flexion and extension, abduction and adduction of the hips, and then the strength associated with those as well. So what I want you to do, Kristen, is grab onto this table here, and I want you to bring your knees up against the force of my hand here. Perfect. So 5 out of 5 strength on hip flexion there. Next, I want you to extend your legs backwards, keeping them straight. 5 out of 5 muscle strength there on extension of the hips. Perfect. And then next, we'll perform hip abduction and adduction. So I'm going to have you continue to hold onto this table, and I want you to cross your right leg over your left while pressing against my hand. Perfect. Now bring it back, and awesome. And then we'll do the same on the other side. Maybe you want to turn around so you can lean on that table. Perfect. So I'll have you cross your left leg over your right. Perfect. And now bring it back out in abduction. Perfect. Great. So those are 5 out of 5 as well. The next thing I'm going to do, since Kristen is standing up, is perform a Trendelenburg test, which assesses for any hip dysfunction. So what I'll have her do is flex her hip, and if her back deviates from midline, if she were to raise her leg using the flexion of her back, that would be indicative of some hip dysfunction and would warrant further investigation. So would you bring your left knee towards your chest? Perfect. She was able to do that. Negative Trendelenburg. We'll do it on the right as well. Perfect. And so negative on Trendelenburg's test. The next thing that we'll do is have Kristen sit down on the table, and we're going to assess her knees and ankles. The first thing I'm going to do is inspect her knees for any asymmetries, bony abnormalities, any discoloration, swelling. I'm going to assess for heat. Everything feels normal as far as that goes. So I'm going to palpate the tibial tuberosity, the patella, the femur here, and everything upon palpation is in normal findings. Next, I'll assess, would you scoot forward on the examination table a little bit? Thanks. We're going to assess the strength of Kristen's knees. So we'll have her extend her right leg first. Perfect. That's a 5 out of 5 strength. And we'll do the left now. 5 out of 5. Perfect. Then we'll have you bring your knee back towards you in flexion. Perfect. 5 out of 5. And another 5 out of 5 there. The next thing that we're going to do is assess the ankles and the feet. So I'm palpating the medial and lateral malleoli of each ankle, inspecting for symmetry, size, swelling, color, etc. And then I'm going to palpate the tarsals and be inspecting for any abnormalities there. Everything looks normal. So the next thing that we'll do is test the range of motion of Kristen's ankles. So would you bring your ankles, your feet up towards you, now down, so in plantar flexion. So dorsiflexion and plantar flexion seem normal. Next we'll have you invert your feet, perfect, and evert. So all normal findings there. Next we'll have you flex your toes and extend your toes, all normal. The next thing that we'll do is check out some tendon reflexes while Kristen's in this position. So we're going to first check out the patellar reflex, which is the L4, L5 nerve root. So I'm just going to be tapping on her patellar tendon and looking for leg extension at the knee. Okay, so that's a 2 of 2 finding, and here. And a 2 of 2 finding, or 2 of 4 bilateral, which is normal. The next thing that I'll do is check out the Achilles tendon, which is S1 nerve, S1, S2 nerve root. So I might need to ask Kristen to relax her ankle here and help her do it by kind of rotating it. The next thing I'll do is I'll support her leg and I'll tap on that Achilles tendon, looking for plantar flexion, which I'm seeing. That's a 2 out of 2 or 2 out of 4 reflex, and I'll do the same on the other side. All right. And another 2 out of 4 reflex there, which is a normal finding. The next thing that we will be assessing is I will have Kristen lay back in a supine position on the table, and we're going to perform the straight leg test. This is assessing for any herniated discs. And I'm just going to adjust the camera angle here. Thanks for your patience. This is going to assess for any herniated discs. So what I'll have Kristen do is slightly raise her right leg or left leg off of the table. Just a bit. Perfect. Do you feel any pain there?
No.
Okay, perfect. And we'll have you do the same thing with the right. Perfect. Now, if Kristen was experiencing any pain here, then that would be indicative of disc herniation or a lower back injury. The next thing that I'm going to do while Kristen is seated this way is do a plantar reflex test, also known as the Babinski test in infants. So what I'll be doing is using the end of my striking hammer here, and I'm going to basically draw a line towards the distal lane of our foot towards her toes. And what I'm going to look for is flexion of the toes. Now, if she were to extend, that would be an abnormal finding, indicating some nervous dysfunction. So, are we ready here? And you'll want to get patients used to this because oftentimes they're ticklish. Okay, that is a normal finding. Her toes flex forward in plantar flexion, and same on the other side. Perfect. The next thing I'm going to test for is internal and external rotation of the hip. So I'm going to bend your knee, Kristen, and I'm going to externally rotate and then internally rotate here. And then same thing on this side, internally rotate and externally rotate. Perfect. Normal range of passive motion there. Let's see here. I will now move on to a couple tests that are assessing for ACL injuries and meniscus tears. So the first one is a ACL injury, which is called a Lachman's test. So I'll have you sit up on the table a little bit more and kind of scoot towards the edge. And this is what I'll do is I'm going to be putting my index and middle fingers kind of on the tibial side of Kristen's, the dorsal aspect of Kristen's calf here against the tibia, and then my thumbs on the femoral distal aspect of her knee, and I'm going to be pulling forward, pulling her leg forward at the head of her tibia on the proximal head. And if I'm feeling any sublimation there, that could be indicative of an ACL injury here. And you'll want to do both sides, and I'm not feeling any subluxation there. So we will consider this a normal finding. The next thing that I'm going to do is I'm going to have Kristen lie in a prone position, and I'm going to do a couple, actually while you're seated like this, let's do some distal proprioception too with your toe. So again, just like you did with your finger, tell me which direction I'm moving your toe.
Down, up, right, left.
Okay, so she got all of that right. We can move on. So the next thing that we'll do is have Kristen lie prone on this table. We're going to do a couple tests. The first one is called Thompson's test. It is to assess for an Achilles tendon rupture. All I'm going to do is squeeze her calf, her gastrocnemius and her soleus muscles, and I want her foot to dorsiflex, or plantar flex, I'm sorry. And both of her feet are plantar flexing here, which indicates that her Achilles tendon is intact. The next thing I'm going to do is perform a McMurray test, assessing for a meniscal tear. So basically what I'll be doing in each knee is I'll be bending Kristen's leg, I'll be externally rotating her knee here, and then I'll be applying valgus pressure at the knee, And when I will flex her knee while I'm palpating at the joint. And if I feel any cracking or popping while I'm performing this test, or if the patient experiences pain, that would be considered a positive finding. And I'll do the same on the other side. Again, external rotation with valgus pressure and movement, inflection, and extension. Are you having any pain, Kristen?
No.
I'm not hearing any popping or grinding. So we would consider those tests negative. The next thing, would you sit up on the edge of the table, Kristen? Thank you very much. The next thing we're going to do is assess cerebellar functioning. Cerebral functioning. Thank you. So we're just going to ask Kristen a series of questions and play some memory games, that sort of thing. So the first thing we'll do is assess recent memory. So Kristen, can you tell me what year it is?
2018.
How about the month?
June.
How about the day?
17.
Okay, what state are we in?
Colorado.
How about the city?
Denver.
What street are we on?
Trenton.
Perfect. Next, we can move on to more past memories. So the way that we'll assess this is I'm going to tell Kristen 3 words to remember. I'll have her repeat them, and then I'll ask her what those words were when I get a little bit further through this examination. So the 3 words I'm going to ask you to memorize are apple, baseball, and table. Okay? Would you repeat those back to me?
Apple, baseball, table.
Okay, remember those words. Okay. So next we're going to have her do some simple math. So what is 150 together?
150.
How about 20 and 70?
90.
Okay, how about that number minus 30?
60.
Okay, how about that number plus 15?
75.
Okay, so her thinking seems to be intact here, her thought process. We can do a little bit further examination. I'm going to ask you to spell a word forwards and backwards for me, okay? How would you spell folder forwards?
Folder is F-O-L-D-E-R.
Okay, how about backwards?
R-E-D-L-O-F.
Perfect. So while Kristen's saying all this, I'm assessing her speech and her language. She's not having any aphasia, problems recollecting any words. Her speech is normal. It's not dysarthric. And so we can move on. Do you remember those 3 words that I asked you to remember?
Apple, table, baseball.
Perfect. Well, all of her cerebral functioning seems to be intact. So with that, we can conclude the extended neurological and musculoskeletal exam. Thanks very much for watching.